Welcome to an epistemological evolution. I thought because you're all academics and community organizations, you'd love the word epistemology, especially for challenging it, right? My name is Esther Lucero. I'm the Director of Policy and Programs at the Native American Health Center.
And I'm Miranda Worthen, and I'm an assistant professor at San Jose State in the Department of Health Sciences and Recreation.
And today we want to start this conversation, and we really want it to be a conversation, so please jump in at any point. You'll find that because this is about relationship building, that Miranda and I will sort of demonstrate a little bit of that today. Yeah.
Absolutely.
Okay. First, is it okay if we're sitting down? Is it okay?
Kind of reminds me, it's okay if you're us already.
Okay.
So that should mean that we'll be able to hear you when you ask us questions.
Yeah. If we'd known that we were going to be in the basement with this weird fluorescent lighting, then maybe we would have worn something a little differently, but we'll work through it. Okay, so the Native American Health Center, I just wanted to let you know what our mission is, because perhaps it might be a little strange that we're at a community-based participatory research conference as a health center, right? So our mission is to provide comprehensive services to improve the health and well-being of American Indians, Alaska Natives, and residents of the surrounding communities with respect for cultural and linguistic differences. Okay, so that sounds like services, right? So how is it that we're here talking about CBPR? Well, I'll tell you that the health center evolved from an activist movement. And since we're at San Francisco State University, I think it's important to recall the Alcatraz occupation of 1969, right? And it's because it was during that movement that the need for health services for an urban Indian population came about. And so the health center came as a response to that need. Okay, so what that means is certainly we provide, medical services, dental services, behavioral health services. We do all of those things, but we're also a community center. Because guess what? 70% of all American Indians now live in urban environments. So, do we have tribal communities to go to? No. We have an intertribal community here. We have over 200 tribes represented in the San Francisco Bay Area. And so that means we as a health center do a lot of things for our community. And one of those things is around advocacy. We have a responsibility to our community to provide services that are beneficial to them, things that they want to see, right? And so we're always responsible to our community first. So we needed to look at a few things. We need to assess our capacity. So my position and our evaluation team are all housed in our behavioral health department. And guess what? We have some really fantastic staff, and a couple of them are here. So we have a lot of people with MPH degrees. We have a lot of people with extensive data history on our evaluation team, and they're all still pretty new. Many of them have a lot, just a strong interest in research, and particularly research within communities, within our communities, and we needed to help them and support that vision, right? We need to help support them in their desires to implement research like that. We also have a great need because we, as a health center and as Native people, are constantly being affected by things like an evidence-based practice system. And guess what? Not typically built for us. Many things that we do, many services that we provide, many evidence-based practices have not been tested in our communities. So we have a great need to do that for our communities. And what are our dreams? Well, our dreams are to be completely autonomous, right? To exercise our sovereignty. Yeah. To be responsive to Indian self-determination. We'll talk a little bit more about those things in a bit. Guess what? We found somebody to help us with some of these things because we have these fantastic MPHs. We have lots of people from multiple disciplines. We don't have a PhD. And we don't have a researcher. We don't have that in our health center. Yeah, we could ask our MDs to step in, but they're pretty busy. Yeah, they're pretty busy doing direct service. And so we found Miranda. And I'm giggling because I knew she would not like that I put her picture up on here, but it was significant because we really did develop a relationship with an individual, right? We're not talking about a complete academic institution. Miranda?
So I'm the academic partner in the relationship that we're talking about today, and I think it's important, as weird, Esther put my picture up and I was like, oh no! But I actually think it's important to honor and to kind of acknowledge that it is generally an individual that you're forging a relationship with. And as you spoke about love, I think that happens between people and that happens between individuals. And so I'll speak from my role as an individual, and I'll talk about my role within my institution at San Jose State as well, and how those fit together. So I actually started this relationship with Native American Health Center right when I was finishing my PhD. I had already gotten a job at San Jose State, but I hadn't started that job yet. So it was nice to actually bring that in when I started my new role at San Jose State. Can I just see who here is an academic and who comes from a community organization? And what other roles do you all inhabit?
The health department.
I keep forgetting you. Health department, right. So government, state services,
Mm-hmm.
yeah. Anything else?
Faith-based.
Mm-hmm. Okay. So from the perspective of an academic, I had about a decade of experience in CBPR, but none of it local. I worked in West Africa for several years on a project doing reintegration of girls who had been child soldiers. So I came with some methodological experience. I also have a PhD in epidemiology, and so I have some of that technical expertise around data analysis, around study design. But I think the other kind of capacity / need and dream that we talk about that it's important to honor up front is about knowing who you are and what you personally want. And as Esther and I were kind of talking you through this presentation, a big part of why I was interested in this partnership is not necessarily because of the exact issues to hand that I was originally brought in to work on, but because I care really deeply about being engaged with community members and in social justice work. And the reason that I wanted to do a PhD and get that knowledge was to do this kind of translational work. And so I've often, I think even as a young child, I saw myself as playing a kind of translational role and kind of navigating multiple worlds and doing advocacy with that knowledge. And so my dream entering into academia was to do grounded work with community partners that was going to be of service. And so that was kind of what I brought to it.
And that's not to say that we didn't have our own knowledge. I don't want to discredit that at all. We certainly have community knowledge. And we have our own methods when it comes to, yes?
Just curious, who contact who?
Yeah.
Well, yeah, so I'll tell the story a little bit as we go.
Oh, it's coming later.
But I'm happy, I think we can launch right into it. The woman who she was the acting director, I think she's now the director of the department that Esther is in, Serena Wright. I'll tell my side, and then Esther will tell her, because like, this is actually different.
Yes.
Right? So I got an email forwarded through a professor of mine who had gone to, who had done her master's with Serena. And Serena said, we are looking for a person to work on a suicide prevention project for Native youth as an external evaluator. And I think I'll explain in a little bit more detail about that first interaction after the next couple of back and forths. But that was, so I got kind of asked, someone sent me this email and there was the opportunity to reply to say I was interested, and I replied. And we had a couple of conversations and meetings, and but that was the direction of the partnership.
Yeah, well, so the pre-conversation is, shoot, the funder is requiring that we have an external evaluator, right? And so we weren't fans of that, we were just like, okay, who are we gonna bring in? Who is it that can help, who understands our community? Who can come in with respect for the knowledge that we do have? Who can fill this role, Ideally, we want a Native person, very hard to find. Very, very hard to find. And so it was like, how do how do we negotiate this, you know? So we said to our supervisor, Serena Wright, and, you know, and so she went on, she comes from Berkeley as well, Cal, and she has an MPH there, so she's connected with that, and I think that she's very much in tune with the things that our community really needs. I mean, she's worked as an evaluator for us, you know, for years before becoming our department director. So that was our initial conversation, and finally she says, I think I have somebody, you know, and I'm ready to have you guys have an initial meeting. And we'll talk about the initial meeting.
Okay.
Yeah. Because so the next piece is that we had responsibilities, right? Both sides have responsibilities before entering into this partnership. I want to explain a little bit of that, what that looks like. So for NAHC, we have responsibilities that are, like I said, first and foremost to our community, right? But why? Because tribal nations are sovereign nations, you know? And we have rights afforded in the Indian Self-Determination Act in 1974. They said, oh, guess what? We've been doing this wrong. The whole time we've had this like kind of patriarchal relationship with Native people, and now we know that you guys know what's best for yourselves. And we're like, oh, thank God, in 1974 we know what's best for ourselves, you know? But the law finally shifted, and they said, so now we want you to decide how you implement programs, you know, what kind of health care you provide. And then that same right, the Indian self-determination rights, were extended to urban Indian agencies in 1988. So we have those rights in urban areas, right? We have responsibility to that. We do. And funding agencies were dependent upon money, right? So money often like runs the world when we know that. And so we're always having to be responsive to our funding agencies. Well, guess what? That means that they dictate how we take care of ourselves. Yeah? We have to find ways to challenge that. That's our responsibility. We have to do that. And then, why do we have to do that? Because our community does know. Because we have a wealth of knowledge, you know? And we have to bring those voices to the surface. We can't continue to keep them stifled. You know, we have to increase visibility. We have to increase visibility in data. We have to increase visibility in these forums that we talk about. Like, those are our responsibilities as an agency. Miranda has responsibilities too.
So I was thinking about the presentations this morning and the questions as well that followed, and I think so. I asked Esther to add in this self actually as the first thing, because I think the very first responsibility I, as an academic partner, have not being a part of the community is to myself to own who I am, and it's kind of a responsibility to others to be who I am and not try to be someone else, and to recognize that, and that includes both my values, where I have like a lot of integrity about what knowledge is and academic knowledge and how those matter or don't matter, and mostly I have values around kind of respect and integrity, and then to academia, you know, I think it was the first question who asked about, you know, when you partner, you often partner with these junior faculty, and then they have to do other projects, or you know, for some reason the academic partner can't have the same orientation that we saw exhibited today by the nonprofit partner. And I want to say, you know, I really, having had a lot of experience in CBPR before I actually became an academic, but always partnered with the academic side of things, I was really aware of that, and I was aware of how slow CBPR is and should be if it's going to be done well and authentically. And so I knew that going into a tenure track job, first of all, I was looking at being situated at a place like San Jose State because it does respect CBPR outputs. I wouldn't have felt comfortable, say, taking a job at UC Berkeley where I knew that I would have to be writing NIH grants, which very rarely fund CBPR, right? So I first of all picked an academic home where I could do the kind of research that I felt was important. And then second of all, what I've been trying to do is to maintain a balance kind of in my research portfolio. So I can have stuff like this project, which is really slow to develop academic outputs that are valued by my institution. And while that relationship is being nurtured and built, and hopefully eventually we'll have some academic outputs, but I actually feel very uninvested in having those academic outputs, because what I've chosen to do is to have other parts of my portfolio where I'm analyzing 2,000 person population-based sample of, whatever, and I get those outputs out that way, and I'm getting out my publications so that the pressure is off this partnership, and I can be true to this partnership. And I think that's really important to kind of own as an academic up front. I wouldn't recommend putting all of your academic chits in a CBPR basket, because in order to be honest and authentic, it's going to be really hard to distance yourself from needing to have those outputs and pushing your partnership where it's not comfortable going.
So how do you choose the university? You
Oh.
said, well, I chose
Right.
a university that is very supportive.
And I also fortunately got a job there, right? So it's academia, it's not the easiest field to enter, but.
So why you don't have the pressure of writing grants if your salary is covered by, I don't know, I'm just curious to know how you can assess among the US institutions who is supported and which is
So
not.
I actually did a fair amount of research on what kinds of institutions value what, and San Jose State, like San Francisco State, kind of occupies this middle tier within the US academic, say, hierarchy, where there are like Research One organizations, institutions, like in California, the UC system, University of California system is in that top research tier, Harvard, Princeton, those kind of organizations. And they really hammer hard on people to get those big grants, bring in all that money, churn out those papers, and people don't get tenure there all the time. San Jose State really also values teaching. We don't have independent doctoral programs, so there's not that same need to bring in research to fund your doctoral students. And then there's like the community college system, which values teaching and doesn't really value research at all. But in the middle, there's this tier of universities that values research and values teaching, and gives you kind of the space to do different kinds of research. So my understanding, being new in the system, is that they'll look favorably upon any peer-reviewed papers if they're not published in, the Journal of the American Medical Association, which is, or Nature or Science, the top journals. That's okay. So I can do my research in a way that I know it's unlikely to kind of break that barrier, right? My research, I think it's really important. I think people in this room think it's important, but it's not going to be it's not going to be deemed that important by those top journals. So I'm not even going to try to do that. I'm going to work in this other kind of layer. And then obviously you just get really, really lucky if you get an academic job, and there was an opening when I was applying, and I got
Just out of curiosity, we have a lot of community organizations. How many of you have come across a researcher or an external evaluator who didn't share the same values? Yeah, I see one. Yeah.
I have no experience with researchers.
Okay.
And I am maybe a news organization.
Okay, that's great. Well, hopefully we can help prepare you for relationships with researchers. Yeah. I'll tell you that our agency has had experiences with researchers who didn't have the same values, and it didn't work out well. And so for us, these values that Miranda's talking about are really important. I don't think you get to finish.
Yeah, no, and I think maybe the reason partner agency and community are there as well. I think you'll probably be able to see it as we go through the story we're going to tell. But I do feel an obligation, a commitment to this particular community and to this partner agency. And I think Esther's been talking about how the agency has this responsibility to the community, but I think as an external evaluator, I actually have a different set of roles as well, where I have an obligation to the partner agency. They've hired me. I have a scope of work. There's kind of explicit expectations and obligations, but I also feel as an evaluator that my main responsibility is to the community. And so if I find things within the agency that are not meeting the needs of the community, I'm going to be sharing that with the agency to try to change that, because the community actually is, I don't think I find a challenge there, but I think that that's something to be, I've been really explicit about that, if we decide to evaluate this program because you want more funding to continue doing this program, if we find that this program isn't meeting the needs of the community, we shouldn't then go and try to get more funding to continue doing that program. We should figure out what would support the needs of the community. So,
sure.
Yeah.
I'll just give you one example of that. So we use oftentimes in funding, grant funding, the holistic system of care, which is something that has been developed over a lot of years, but it's never been tested through this kind of scientific method. And so, one of the questions that I think we just call that now, that our director asked Miranda was like if she'd be willing to help us, organize an evaluation of that. And so that's where the question comes, so we're really invested in the outcome that this works, right? And we know that through this methodology, we may figure out that maybe it doesn't, and we as a community organization have to be ready for that, right? And if we're already doing well with it, is it necessary to enter into that research? You see? And so Miranda can say that to us, are you invested in this outcome? And we are. Why? Because that's commitment to the community. We want to be able to do this work that's, for the community. So consider that as you enter into this partnership. Are you going to have somebody who will tell you the truth? Or do you want to be a community organization that decides, if the results aren't what we like, we're going to kind of behave like pharmaceutical companies and just kind of sweep that one aside, right?
Yeah.
Do we want to be that? So those are some of the questions you have to ask. Yeah.
So, hi, I'm Elisa. So you started by you saying we know that this works. So then isn't it been a lot of negotiating about what it is that makes you know that and how you get that turned into measures? Because otherwise, if they come out that it doesn't necessarily mean it doesn't. Okay. Is that a whole heap of the negotiating that happens? That how do we? So we know that this works. So it's that how do you find measures that align with what you know, or measure what you see as valid?
Yeah, and from my perspective, it starts with what are the questions that you're asking? So works to do what? Works how? So this is where kind of I'm bringing some of my knowledge from study design. It's okay, so let's not set us up for something where we're going to get a yes/no answer and not be able to understand what that answer means when we get it. Let's start from a slow process. And we actually had a meeting a couple of weeks ago where we were laying out what would a 5-year approach to finding out whether this works or not look like.
Mm-hmm.
And the first thing is to describe it, actually, because we have it as a theory right now, but we're not even describing it. So what are the pieces that we need to do? So again, from my perspective, my role as an outsider partner is to say, this is one approach to doing it, and kind of lay it out clearly. And again, not be ego invested in the agency selecting that approach, but to say, this from a scientific point of view, this would be one way that we could do this. Along each step of the way, what are the internal barriers we're going to face doing it? What are the external barriers? What are the valuable pieces of information we're going to glean? How do we want to do this? And so we looked at a way that ended up 3 years in or 4 years in doing a randomized control trial so that we could get this listed as an evidence-based practice in a system, in a government system, so that it could be used by other organizations. But maybe we don't want to do that. Maybe we'll find after year 1 what we really want to do is refine this in a different way. So it's about being kind of open, and for me, it's really being honest, because there's, when you're dealing, another one of the questions actually this morning was, what about, different factions or dissent within, a community? We talk about community like it's this, homogeneous thing, when actually it's made up of people, and people have different stakes, and people have different perspectives, and different beliefs and values, and so it's again, I need to be sure that when I go into each room, I'm telling the same thing to each person. And I'm not gonna play my cards really close with this person and then be really upfront with this other person. I have to be again, it's keeping that integrity, I need to be sure that we're talking about this openly, and we all are in the process of making this decision about whether this is the right next step or whether we take some other approach.
So there's a lot of, in building this relationship, it's about listening to one another, being open, and having hard conversations, So.
Or as you'll see later on, dodging the hard conversations.
Yeah. Right. Okay. So we wanted to start here with just our initial meeting. So you know how the phone call happened, and Miranda's kind of called to meet with a few of us, right? And
well, so maybe I'll tell what happened in that phone call. So I had a phone call with Serena to see whether or not this would make sense. And I started the phone call and I'm like, so just to be upfront, I know nothing about youth suicide, and I know nothing about the Bay Area Native American population. I am an epidemiologist, and I have this work. But then I told her why I was interested, and what I shared with you about basically where my heart is, and when I have this photographic memory of where I was walking my dog, having this conversation, and I was like, I'm getting my PhD so that I can be of service to organizations like the one that you're telling me about that I didn't know existed until I got this email. And she said, I think you'll be a good fit, actually. And I was like, okay, that's really good for me to understand that you care very little that I know anything about youth suicide or about Native Americans, but that's what this email was about. But what you're telling me is you care about that value and that ethic, so that's clearly what I need to lead with.
Yeah. So then we have lunch together, and so let's remember we are people, and so we have histories, right? And so my history is coming from an extremely oppressive environment, and it wasn't that safe actually to be a woman of color, queer woman of color. So I knew that I was meeting with a PhD, and my initial assessment was, oh, and she's white. So what do? Well, I sit up a little straighter, I'm extra articulate, I also teach, so I know how to play a little bit of the academic, just kind of play those cards. And so I was really hard on Miranda, and I was really aggressive with my questioning because I wanted to make sure that she was coming from, similar values. Because I know the impact on our community, right? And it's not just me, that's not my personal experience, but I'm telling you, we have what we call a 3 grandmothers test, And if you can't get through those 3 grandmothers, you're not going anywhere with research. And we have to talk about how, historically research has been oppressive to our people, right? And people consistently come in and they take and they appropriate and, they use the data to paint us in a way that just isn't always accurate, We deal with that even with our government entities. Actually, I'll save that story for a little bit later, but sometimes where is the data going? And how do we honor sovereignty? So anyway, so those are the assumptions that I walked in with. And I meet Miranda, and you know what? She was really nice. And she was nice, and she was and she didn't make any, it didn't seem like she had assumptions. She asked a lot of questions, and she was humble, and and so I felt like it initially softened me, right? And I think a few other people as well. Yeah, but we had constant barriers, just based upon those assumptions that I gave you, PhD and white. So, do you want to talk about some?
Yeah, and I think for me, navigating that, there was some that I was able to kind of sense that something was going on, but also my instinct was not I missed a lot of the backstory, and I'm a pretty sensitive person around group dynamics, but I could tell that there was stuff happening, but I couldn't piece it. I didn't know, and
I have another example.
Yeah.
So speaking of that 3 grandmother test, we have one of those grandmothers in our agency, and Miranda had to have one of the very first meetings on the Native Youth Wellness Initiative, which is our suicide prevention project, and she was meeting with one of those grandmothers, and from Miranda's perspective, she had no idea, but right after that meeting, this woman was in my office complaining about why would we hire a white researcher, and she's just going to come in and do the same things that other researchers have done, and she was dominating and I lost my voice and, you know, all of these things, and that we're dealing with historical trauma, right? So what do we do as an organization? Well, we meet and we nurture that, and we try to work through that healing process. Like, that's our responsibility, going back to that, you know, and try to assess, really, is that really what's happening, you know, or are we just revisiting some of the things that we're familiar with from the past, you know? So that happened.
Yeah.
And it's funny because in this process of like developing this presentation, Miranda's like, I had no idea that happens, you know?
Really? I always thought that she and I got on really well, but in that meeting, that same, you know, there's another woman and she and I could totally tell that something was off. You know, so there were some times where I totally could sense things, and other times where it was like really not visible to me and not being expressed directly to me. And you know, we were trying to talk about like navigating that, and one of the things I kind of kept coming back to is like trying really hard to like push the ego down and like not take things personally, or you know, just like let things go. And I think part of that for me was, again, like coming in being like, I'm here to be of service, and if I'm not the person that is needed here, that is okay. Like, I personally don't need this. This agency needs somebody, and if I can be that person, then that's wonderful, and I will gain a huge amount, you know, I will learn a huge amount from this, but I don't need this, like, it's not it wasn't my choice, you know, and I didn't feel like there was a whole lot I could do aside from being who I am to see, like, whether or not this was gonna work.
Okay, so those are a couple of barriers, right, we talked about. And certainly there were a lot of others that we were able to work through. And then guess what happens? All of a sudden it was like, oh, Miranda's amazing. She's the expert, you know? And it was like we disempowered ourselves. We forgot what we were great at. It got to the point where I specifically remember one phone call where my team I asked for a conference call with Miranda to develop a PowerPoint presentation, you know? And it was like all the information was there, and all we had to do, they wanted Miranda to tell them how to present. And I remember being angry, actually, and I just said to everyone, I think we're perfectly capable of developing our own PowerPoint presentation. Thank you, Miranda, for your time. We're going to get off the phone, you know, and revisiting it with my team and saying, you know, you all have done several presentations. Like, let's not disempower ourselves. Let's remember where our strengths are. You know, we have incredible people in our agency who can present extremely strong, you know, charismatic, sharp, you know what they're talking about. We don't need, you know, Miranda to help us with that. But
and so part of, like, I think that phone call, part of it was also about, like, literature review. Like, there was some other part of it that I felt like I was able to, you know, add
right.
not, you know, some substance to, but basically, like, I heard Esther say that, and again, it's one of those times where you're like, that's right, like, she knows how to do this, people know how to do that, like, that's not what my role is, I don't need to be that person. And, you know, we revisited that, and so again, it's like, I think as an academic partner, you have to be really sensitive to the cues and to the, you know, to that voice. But I think the other story we were going to tell here was about Red Vision. So
yeah, so again, because we were having so many barriers, we sort of made a strategic move as an agency. We had another project going on. This one was more about policy change related to the evidence-based practice system and about the uses of data. And we knew, so we had some expertise in kind of community development, community program development. We had some expertise in policy advocacy. We had expertise in data, not quite research, but data and technology. And then also the media components that were part of the strategic plan. But we didn't have somebody who had that strength in evaluation to develop a comprehensive strategic plan to change the system, right? And so we knew that Miranda definitely had those skills. So we brought her on with a team of, we had a work group also where we were collecting information, and we needed to get Miranda exposed to the ways that our community carries knowledge and what knowledge that they do have. So we invited her to the table to write the evaluation component of the strategic plan. And I think I gave you an assignment, right? Yeah.
Well, but it was really funny because basically, you know, I had been brought on to do this other thing, and then like 6 months into the relationship, I think Esther, or maybe one of the other people on this team, you know, asked me to write their 5-year strategic plan for evaluation. And my first response was, are you serious? what? You know, like, that's your strategic plan. Like, that's so precious. You know, why would you give that to me? But it was this opportunity then to kind of, I knew that I knew nothing. And so what I could do is ask everyone who knew something. And there were actually a lot of sister urban health organizations that were a part of this big strategic plan. And it gave me the opportunity to have in-depth conversations with people in those other organizations to see, you know, what they were doing, what innovations they had come up with, and to bring that in. And then to bring in some of that academic knowledge, right, about what's going on in the field. So I brought in language around CBPR into the strategic plan, and we talked it all through, and we were able to develop that, I think, quite well together.
Right.
And so it was one of those opportunities where at first I was, you know, we'll talk a little bit about roles, but, you know, I've definitely felt my role change through this partnership, and that was one of those moments where it was like, you know, you're going from this kind of small little project to suddenly we want you to do this completely other thing. It was a different grant, it was a different everything, and it seems like something that carries a very different kinds of responsibility to the organization. And so I think in a way it was like a little test to see how I would carry that discrete task out.
It was definitely a test, I will tell you that. And also just how she was going to communicate with our work group members and what she was going to bring to the table, but really she added a lot of structure, right? So it was a way that we combined all of our areas of expertise and created something pretty amazing, you know? And so it was kind of a reminder not to disempower ourselves, you know, and it was a reminder to be constantly open to the potential and possibilities, right, based on just talents. So, okay. So then, of course, it continues to grow. And you want to talk about this? So remember I told you we have a lot of dynamic people? Can my people please raise their hands? I keep looking at you because I'm distracted. So this is our evaluation, part of our evaluation team here. Chirag Patel, Angel Hato, and Lauren Boehner. And so I'm really happy to see them here so that they can hear that I give them kudos wherever I go. But the reality is, I mean, we have a lot of talented people who are, you know, who are really innovative and have fantastic ideas, right? And as an agency, like, it's our responsibility to help them bring these things to fruition. We have one clinician. He's a clinical intern. His name is Virgil Moorhead, and he is an innovator.
Remember that name because you're going to hear it, I'm sure, in the world out there.
Yeah.
One more time.
Yeah. Virgil Moorhead. Yeah. And so he came and he was doing his clinical work with us, and he was in the process of developing his dissertation. And so we had been doing digital storytelling, you know, and he definitely saw the potential for research involved with digital storytelling and assessing it as a healing modality. And so so then Miranda is around. We know that she has skills now, right? We've tested her, and we know that she can work with us and, you know, listen to some of these ideas. And so if somebody approached her with, let her know.
Yeah, so basically I was, the first meeting I had about this digital storytelling project, I was with a couple of people, but Virgil wasn't there. And I kept asking, like, so what is the agency's, you know, role in this? What is the agency's stake? And it kept coming back to, like, well, Virgil has to get his dissertation written, so we're doing this. And I keep being like, I'm an academic too. Like, I'm not going to prioritize my dissertation over my community's actual needs. Like, he needs to find a dissertation that actually, if he's going to be using data from this community, it's going to have to serve the community. So there's going to have to be not just he goes off and gets his dissertation written, but actually he chooses a project that serves the community. And at first, like, people were kind of resistant to that and kind of unclear about, you know, why I was kind of talking about that. And then I met Virgil, and
because of course, going back to, because we know this works. We know this is great for our community, right? That was our response, you know.
Yeah.
But here we are asking somebody to help us figure out how, and it, you know.
Yeah, and so then I started working with him, and he has so many great ideas, but a big part of what I was doing with him was kind of shaping it into, well, what is the research question that's going to both get you a dissertation, but also answer a valuable question for this organization, for this community, about how digital storytelling works. And so I basically then kind of, again, thinking about the roles, like I think mentorship has also become a part of what my job description is at NAHC, and that was not in my original scope of work. It actually is now in my scope of work because I put it in because it became so much of what I was doing. But both like Lauren and I had a conversation in a cafe that, it's like, I don't know who to build this to because this isn't about that grant, this isn't about that. But it was about Lauren building her capacity and, being a sounding board for her ideas about this project. And same thing with Angel, like we've had these conversations and it's like, recognizing that I, have some other, domains of knowledge that I'm bringing in, but actually so much of it is happening right here. And so.
And let's not forget, it's about increasing our capacity. Miranda, I really like you, but I'd love to not have to have you.
Yeah.
I'd love for us to be able to handle this internally. So, so we have to keep that in mind. So mentorship is definitely valuable. And because the research was digital storytelling, we knew it was also very sensitive, And so we had a couple of things. We've done a cultural adaptation to the way CDS does digital storytelling facilitation. And so we wanted to maintain the integrity of that adaptation. And it's easy to get caught up in, I'll just get some equipment and we'll just create some digital stories. That's not the way it works. It's actually the process that we wanted to assess. And so while Miranda is, mentoring Virgil to keep him focused on like identifying the question and making sure that he holds true to the research, we are providing mentorship to say, let's make sure that we hold true to practice, And so it requires sort of this joint effort. And we want to just show you a few stories so that you can understand why. Let's see here. And this was one of the technical difficulties. So if you'll bear with me for a moment, we're going to drop this down.
My dad died drinking on the streets. I remember the great sense of relief I felt, finally knowing the end. When we're waiting in fear of the phone to ring, to hear some horrible news. It was done. My parents moved to California on relocation from the reservation in 1956. They were taken away from family and everything that was familiar. I don't know exactly when my dad started having a hard time. My early memories are hazy pictures filled with chaotic emotions. As my father spiraled downward, the question always lingered in the forefront of my mind. Why can't he change? My mother tried to explain. Alcoholism was a disease. He was a good man, father, just sick. And still I asked myself, what could wound a man so deeply he could just give up? As I reached back to learn the secrets of my father, I discovered the weight of our history and the source of those wounds. I struggled as I witnessed my brothers suffer, unable to break the cycle. I became a mom in a week. My boy is the son of my brother. I learned he existed on the day he was born, and 1 week later, he was in my home. My brother died hours after I signed the adoption papers. Grief and anger hold us captive. It freezes us. It takes away our ability to trust life. It makes us unable to move forward, to heal, to let go. When I look at my son, see him smile and laugh, he gives me hope, the courage to move through the fear, not to forget those who have come before me and whose wounds that I carry, but to remember that I have the power to change, to receive, to live.
you can see this is one of the first digital stories that we did, and we want to share with you just a few of the youth digital stories, because the next research project we want to talk with you about is called a cultural exchange, specific to youth.
I had a memory I could almost see. The snow gave me glimpses of what my future might be. The neon lights that shone down from the sky, more colorful and more brilliant and less vacant than my eyes. Alaska, a place where winter is dark, both night and day. And summer is light, always, and basically the same way. My God, I miss that place. Because we live in California now, and it's not so bad, or not as bad as before. When we first arrived here, we lived with my grandmother, but seeing as there are 9 members to my family, and there were already 3 people living with her, she had no room for more. Everything costs more. Everything costs more in California. Things like clothes and books and homes. Homes we could not afford, or rather, we could not afford a house. So we moved into a hotel, all 9 of us. But we could only afford 1 room, 4 walls, 2 beds, and a 4x3-foot kitchen. For 7 years, we made that our home. We shared beds, we shared a bathroom, and anything else that we owned. Everything cost me. I will never forget my siblings and I taking turns telling my little brother stories in order to distract him enough from reality and into the bliss of sleep. Our made-up stories always had happy endings, so he slept deep. Then when I was 13, I found a way out, or a sort of escape route. I found a dance class, an oasis among so many buildings. Dance became my friend. It listened to everything I had to say. I could move and shake free of being boxed in for days. I could express the passion for expression I had within. Dancing had become my friend. It talked to me about my memories of a place I had once been. It hugged me close, like the snow that used to stick to my shins. Dance sang to me and I swayed to the sound. Like an unwrapped present, I was free, unboxed and unbound. Dancing had become my friend, and life was exactly as Alaska had been. Beautiful again.
We're going to continue with the youth, and this is leading into our Native Youth Wellness Initiative, which is again about suicide prevention, and also what we call the cultural exchange, which is a research project that evolved from that. So we wanted to kind of give you an example of the youth
who are here to serve.
Yeah, who are here to serve.
I am me and nothing different. From a very young age, I always felt different, from the way I wanted to dress to the way I acted. Growing up with my family dressing like their little girl, I always had a smile on my face. Little did they know, I was very unhappy. I did not feel like I was me. till I reached the age where they let me wear what I wanted to. I remember this one time when I was playing with my little sister. I felt so good, like myself,
Sorry, you guys, we didn't put it.
because I was able to wear what I wanted to. That day, I was in blue jeans and a gray plain tee. When I
Yeah.
So once these videos were made, you showed them to the community. How was that done to everybody else?
Yeah. So there are a few,
No, she's great. I'm telling you.
so the first time they're shown is actually right after the workshop, and we have a grand viewing with the participants of the workshop. And then after that, it's up to the participants, right? Whether they want to show them in public forums or not, they get to decide. They can revoke privileges at any time, like it's up to them. So this particular youth, or all of these youth, agreed that they wanted to have it spread as far and wide as possible. So yes, we have shown them in workshops like this, or we've shown them in bigger forums.
A film festival, basically.
What about parental consent?
Yeah, we also get parental consent for youth underage. Yeah. Uh-huh. So we've done it in a variety of forums, and we've shown them to political entities. We've shown them to funders, and I mean, on a national level too. We've done presentations there, depending on what they want.
So I'll just say, so Virgil's project that we're working on right now is looking at the impact of the process of making these digital stories on the participants themselves, interviewing participants about sort of why they decided to do one of the workshops and what happened during the workshop for them as they made this story. It's a 3-day workshop, is that right?
3 to 4 days.
3 to 4 day workshop, and then about kind of the follow-on, like how did they interact with that story? How did they use that story themselves? How did doing that story change their life or not? And part of why he wanted to ask that question was because it seems the community knowledge that we know is that this is really therapeutic. And so what we're looking at is exactly how is it therapeutic? If it's therapeutic, which people is it therapeutic for? Are there differences? What stories people choose to tell? Are there some people for whom it's actually painful or more challenging than others? So all of that we're trying to know. And he's doing a kind of small qualitative study right now, just interviewing a handful of participants. And then we're going to take it from there and see what the next step is once we've gained that knowledge.
One of the questions, were these stories part of a grant, funding opportunity? I mean, were they paid?
Yeah, so if you look at
Were
the
the
credits,
participants paid?
Yeah,
No.
well, this lady was paid for tell her story and
no, the way the grant worked,
so how they were contacted, how, you see what I'm trying to ask?
you're asking kind of who are the participants and what's their relation to.
Yeah, I mean,
Yeah.
how do they know that they could tell their stories? How was the selection process? Why you this and this other participant?
Sure.
And if they were compensated? You said no.
So nobody was compensated. And we've done several workshops. We now have about 64, I believe, digital stories that we've done. Usually it's max 10 person per workshop. So we've done some that are specifically focused on a specific grant objective. For example, we've done an alcohol and drug prevention workshop for Native women and girls, right? So we had kind of a multi-generational workshop that was focused on that. We've also done the Native Youth Wellness Initiative that's focused on youth and strengthening their cultural identity. So we've done a variety of them. We've also done some that are just open. And so what we usually do is, because we have project leads, the project leads will identify participants. Or we've also done it where it's an open call-up, where people can ask if they can do a story. One of the things we're working on right now is how to provide a better assessment, because really doing digital storytelling is not for people who are in crisis. And it has to be a group of people who work through things. And I mean, that's what Virgil's looking at as a clinician, because I mean, you can tell just from what you've seen. First of all, you could have a ton of questions, research questions, right? And second of all, it's hugely impactful, emotionally impactful, right? Yes.
My question is, I see this is a very good way of motivation and change. But my question is, was he the original of doing digital story?
No. So, go ahead.
So I'll say something. So in community-based participatory research, there have been, for years, different ways and methodologies used to have people tell their stories. So in CBPR, there's this whole world of, people taking photographs and telling the story of their photographs, or people using video or something like that. I'm not sure what the relationship between kind of that history of methodology and something called digital storytelling is, but Esther can talk about how digital storytelling came into NAHC's world.
Right. So we actually received facilitators training through the Center for Digital Storytelling. And Joe, I can't remember his last name, but he was one of the originators of this process. And so what happened was we received the facilitator training and we identified ways that it actually fit in with kind of our cultural practices, but we also recognized ways that it didn't. Yeah, like where there were some things that were very formulaic and, it didn't allow for kind of like this organic process to happen, where there were time limitations on things and prayer wasn't incorporated. And, so we incorporated kind of like talking circle perspective. We incorporated prayer, we incorporated smudging, and, things like that mean something to our community, that help us with our healing process.
I can see the potential of this helping other peers. But I'm curious on how this specifically to that woman helped her.
I mean, that's what he's assessing, right?
Well, so also to start with, this young woman, Miranda, she actually has been a part of a number of different programs that are done by the organization. So it's not like she was plucked out of her community to do this story and then put back in. Like the organization has a relationship with her. She's actually, she's come on the cultural exchange that we'll be talking about a little bit more. And so the grants, so I think part of your question is also about like how the grants are structured. So the project that I was originally brought in to work on was funded by SAMHSA, the Substance Abuse and Mental Health Services Administration. And as Esther said, they had this requirement of having an external evaluator. In reading the grant, there are a whole lot of different practices that the organization said they would do over a 3-year period to support, to provide services around reducing mental health problems and substance abuse issues and increasing resilience within the community. And so this is one of the activities that was described as being a practice that would work on these particular issues.
Mm-hmm. And stigma reduction is another piece. And so we've
But again, that will help others, but that's specifically individual.
That's what's being assessed.
Yeah, that's what Virgil's dissertation is going to be.
Ah, okay.
How does it help people? Does it help people?
Okay.
All of those questions. Yeah.
It's coming soon.
Well, we hope.
I know it can be sort of problematic, but was there any possible brainstorm on how you could possibly partner with professional organizations like StoryCorps, where they have a very large audience base and a lot of support that they can get in one way or another, not just just volunteers or equipment.
I feel like no, we haven't explored that because we have everything we need in house. We have the capacity, and so yeah.
But it's also because that's where the priority for the capacity is. Like, these are the stories coming from this community, and this community needs to be the one making the stories and telling the stories and deciding where to share them. So it comes back to that sovereignty issue as well.
Yeah, and it goes back to also holding cultural integrity as a practice, right? And there isn't anybody out there who's doing it the way we're doing it. And so, yeah, so that's part of it.
However, part of the idea of doing research on it is also to say, are there things that can be useful for other communities that we learned by doing here that has been developed here? So again, that's part of that, it's a slow process to come up with that systematic, shareable information, but I think that is a goal as well to help, other urban native populations or whatever, however we defined the population that this could contribute to.
You had a question?
The reason why I asked how long originally, because things like that it's kind of slowly come up to Washington State. I saw it's a different kind of approach. They're doing it with the tobacco project also, and it's not all the communities up there. In King County, that's where I learned from this. One of the providers are doing that in the clinic when people come, unfortunately. But the other approach that I saw up there is when we go to lobbying for issues, we bring people, real people that have those issues, and that's how we go to lobby for those issues. Those people tell their stories that are unfortunate. They cut off some of their, resources and stuff. So that's the other way I saw up there in the state where I'm from. But I think the digital stories are kind of a little bit slow up there, but it's starting to come up.
Yeah, I mean, certainly that is a use, and also, I mean, they kind of become digital mentors, right? Because these are stories of people overcoming something, and what message does that send to our community? Is that you can overcome it too, right? So,
and these are on the NAHC YouTube channel, right?
Yes, if you Google NAHC TV, you'll be able to see a whole bunch of the stories, and also our website as well. So, nativehealth.org. Let's watch one more. Are we ready? Yeah, nativehealth.org. I'll write it down.
I am me and nothing different. From a very young age, I always felt different, from the way I wanted to dress to the way I acted. Growing up with my family dressed me like their little girl. I always had a smile on my face. Little did they know, I was very unhappy. I did not feel like I was me. So I reached the age where they let me wear what I wanted to. I remember this one time when I was playing with my little sister. I felt so good, like myself, because I was able to wear what I wanted to. That day, I was in blue jeans and a gray thin tee. When I hit 7th grade, I still felt different, but I always shook it off as being a tomboy. February 28, 2008, I met her. Something connected. I began questioning, who am I? But when we broke up, it started a whole new type of questioning. I wanted to know if it was just her, or if it was all girls I liked. I felt confused and didn't know what was going on. I was just lost. From that time on, the only escape from my depression was music. When earphones hit my ears, it felt like no one can touch me. 5 grades, it started to get better, slowly. I started a new school. I still felt different and still questioned myself. But that year I started to come out to people. Most of them accepted it, but I did lose some. I wasn't going to take another year of depression, so I shrugged off what people had to say or thought. When I entered my freshman year of high school, I was out to everyone. I dressed the way I wanted to, waking up in the morning, throwing on a clean pair of boxers with black skinnies and whatever shirt I pulled out. I finally felt like me. I just felt so lost and not myself when I was home with my family. But when I got out of my parents' car every morning, it felt so good. That bad feeling just went away. Walking into the front gates of the school, seeing friends all around was just the best feeling. I asked myself, why can't you just be you? Why are you still pretending to be someone you're not? I felt like it was time to come out to my parents, not knowing how they would react towards this scary feeling. I worried about being disowned. I decided to type a letter and wrote a measure to. May 21st, 2011 is the day I came out. I am me and I feel different. I no longer have to pretend to be someone I'm not.
Now, we talk a little bit more about the research, right?
So I think you can probably get a sense now kind of why there's so much thought within the organization of how these are powerful, and how a lot of the work that the organization does when you have stories like this that come out and people sharing their personal knowledge, that is knowledge. And so, you know, the role that I'm playing as a researcher is trying to, you know, research is about being systematic, it's about being unbiased, it's about, approaching a question or a hypothesis and testing it. And so I'm working to try to gather this knowledge that's held and to question it, but not question it from a skeptical place, but from a place of trying to understand it better. I think there are risks in that. And one of the things I wanted to be, I think, most upfront about is that the risk in doing this kind of research, there's very, very, very little risk to the researcher compared to the community and to the agency. And so as the researcher, you have to be really aware of that. And so, like we said, like when I get asked to do a new piece of work or something, I want that organization to own the responsibility for taking that risk. And for me to say, if you want me to do this, I will do it. But that means you may not get what you want. And I'm not going to do a research project that is going to be a rubber stamp. I'm going to really authentically engage and try to critically understand something. And I think that there's a very strong importance to that, but I think there are risks involved.
I agree, and I just think as an agency, my advice would be stay really close to the research. I think that when you bring in somebody externally, and they have the skills that you need, like it's easy to kind of take a step back and allow them to lead it. But remembering it's a partnership, and we need to be there step by step because your responsibility is to the community, your responsibility is to the agency, and it's up to you to assess those risks every day. And to address barriers as they come, because they don't go away, and step in when you need to provide mentorship, for your own staff. And so, yeah.
And I want to say the mentorship goes both ways. We've talked about me as a mentor, but I've learned a tremendous amount from Esther and from other people in the agency. I had a really powerful experience the other day. One of the other projects we haven't talked about so much, but one of the questions, the very first time I came into the organization, I read that grant proposal for youth suicide prevention, and a lot of it was about channeling resources to increase referrals from the primary care clinic to the mental health clinic and all of this. And I just asked, so how many people, do you see who are suicidal? How do you actually, how many referrals have there been from the clinic to, and there was no information about that. And I asked, okay, well, what is the rate of suicide in this community? What is the prevalence? And I remember Esther saying, well, I can think of 4 people, and I realized that that's where the knowledge is. And so I designed a research study in partnership with the group, with the team, where we would actually try to systematically gather that knowledge. So the knowledge that these individuals who are strong stakeholders in their community, who have these roots, talk to the grandmothers about actually who here is committing suicide, who's attempting suicide, who went back to a reservation and committed suicide there, so it doesn't count in our figures, but it's because of something that happened here. Trying to understand all of that. The data that exist do not represent that. So understanding we need to gather that. And so part of that, most of that project, the people within the agency are conducting interviews, but there have been a couple of people who have asked me to be the one to do the interview. And so I had this interview with a traditional healer who comes in to do work once a month or so in the Oakland office. And I had just come from this data-heavy conversation, and I kind of ran upstairs, started this meeting, and launched right in. And midway through the conversation, he very, very generously said, in our community, you're American, so you wouldn't necessarily know this, but in our community, when we have a conversation like this, we light sage. You didn't do that. And don't go around to other people in the community without doing that. And it was one of those moments where I was like, thank you so much for telling me and reminding me, because I absolutely should know better. I've been here for a year and a half having conversations like this, and I was in a hurry and I forgot. And
You didn't do what?
I didn't create a sacred space to have a conversation about a powerful topic. And I didn't, he would have, I could have asked him to open a space to have that conversation, to pause and honor that space and honor the people we're going to be talking about and honor their stories, and I didn't do that. And so this was one of those moments, again, where it's like, I think I had a moment of a reaction where I was like, oh, I'm so embarrassed. But you actually have to look at those moments and realize what an amazing gift someone is giving you to tell you the truth. And the knowledge that you have to learn from this person. And so I'm not going to forget that now, I hope.
And again, remove your ego.
Yeah.
Because it will come up a lot.
Yeah.
And Miranda said a couple things here. So there is that lesson with, our traditional healer. She was also talking about, again, being open and identifying, oh my gosh, we're absent, we're missing from the data, And what are we going to do about that? So it's more like solutions-based, We're missing from data for lots of reasons, racial misclassification. I mean, the list goes on and on and on. We have too small numbers, sample numbers, all of those reasons, but finding other ways, so that we can stay visible. And that's about flexibility, it's about listening, it's about partnership and communication. Yeah.
There's a question back there,
Yeah, as you were discussing this experience, very powerful experience, I was wondering how much reflection have you done? I'm sure a lot, but if you could share a little bit of your own transformation in terms of your training you as an epidemiologist. I'm a qualitative researcher and ethnographer, where any conversation I enter, whether it's research related or not, it's about taking a very kind of insider perspective and sort of letting others lead the conversation. But that's not sort of the paradigms, particularly in epidemiology, about how you understand the world. So has that created any, within you, any new questions, any new?
Yeah, so maybe I should be upfront about my role into epidemiology, which was not from the perspective you're talking about. I have mostly been a qualitative person my whole life, and decided to get the tools of epidemiology, recognizing that a lot of the world talks in quantitative stuff, but also for things like this question. It's like, if we care about reducing youth suicide and people in this community know that it's a problem, but we actually have no numbers, we don't know how much a problem it is, we don't know, how it compares to other groups. Maybe actually they're doing phenomenal compared to other really low income populations in a gang-riddled environment. And if that's the case, maybe we want to be celebrating that and teaching other communities what they can do. So it's coming in with this question of what is the information, right? So I think I already straddle both worlds pretty well, and I think that a big problem in the world is that the data people don't listen to the ethnographers, and the ethnographers don't listen to the data. But I like both, and I think both are needed to understand a story of what's going on in the world. So, yeah. But I think the other side of it is I entered this project thinking that I'll probably not get quantitative data out of it ever. And if I do, it's because we've decided to do some study that's going to yield quantitative data. But that was never, like, coming in, that was not ever kind of my personal objective or my academic objective.
You know, and Miranda's not going to talk about this in the way that I want her to, really, but it's also just like a certain level of humility that she comes to us with, you know, and I've never experienced that. And I keep saying, why are you like that? Like, what, you know, what happened to you in life? Like, I'm so grateful for it, but, you know, like, what is it? Can you teach that? Can you bottle it, you know? And can you teach other people to enter into our spaces with humility, you know?
Yeah, and that actually, Esther's been asking me that, and it's actually been, the process of doing this presentation has been really actually awesome in our partnership building. And one of the things also that I feel like she has been pushing me on in a really important way is also thinking about another side of my role as an academic, which is teaching and teaching students. And so thinking about how to teach this and how to teach this well, and how to teach young people to walk into a space and ask questions instead of thinking they know the answer because they have a BA or an MPH or a PhD or whatever they have, because they're white, because they're, you know, whatever kind of power they hold. And so first of all, I'm going to draft her into doing a class with me next semester. But, you know, it is really about, like, that is part of my obligation here too, right, is to actually teach this and share this.
Now I'm curious, before Africa, because I'm a believer that when someone travels abroad and see other cultures, they can identify inside your country other cultures. If you have been exposed to other cultures, then now you can.
Yeah, well, I should warn you, the way I got to Africa, that paper that I sent to this woman who asked me to be a research assistant was proposing CBPR to work with child soldiers, so it was absolutely not Africa that transformed me in that respect. However, it certainly solidified a knowledge I already had. But I mean, if we want to go into psychoanalysis of me, we can. But I think a big part of it actually was being exposed to people from other countries and other cultures. And I had an opportunity when I was a tween to work on an activist project for women internationally. And it was in the US, but I got to listen to other women from around the world talk about the struggles that they were facing in their countries, and that absolutely made a huge impact on me. Of course, I got there for a reason too, but you know, it's like one of those things you can never get to the bottom of something, but I think any opportunity you have to learn is important. Yeah, so we've got about 5 more minutes or so. I don't know, I think we're kind of at is this?
Yeah, we were going to share one more story, but I'm not sure how relevant it is. We want to hear from you. Yeah, so I guess we just want to open it up, and not necessarily just for questions, but maybe experiences you've had. I mean, we always learn from one another, so this is an opportunity to do that.
Well, I love the workshop because I'm thinking, I'm from Montana, and we're working there with Latino migrants, Mexican migrants, and we have come with this results that about 30% of them present symptoms of depression and ethical concern. And as it's so geographically hard to address them, and we're also creating this health promoter program for them, with people, using people from the community. I mean, me and as others more. And we were thinking in using our Facebook platform that we have to show our own stories and to send messages and this is like it's like perfect. It's like really like wow. It's like it's something out there and you're making research with this and it's so awesome that we can have that and those results I would love to hear.
I saw a hand here too.
So I think my take on it might be kind of different because I don't know if there's anybody else here from the health department, but I'm in behavioral health and it's the Office of Diversity and Equity, and one of the projects that I'm coordinating is the digital storytelling that we've taken on. And we just got trained by CDS and Tommy Orange, who you might know, was there, it was great. And so one of the things one of my interests is measuring the level of impact if I were to use this in the community, and specifically we have like 9 ethnic but not necessarily just ethnic initiatives, and so we use them to target our communities, and so if we were to use the digital stories in the context of behavioral health and reducing or eliminating stigma against mental health and substance abuse, how would we measure that? And yeah, so that's just something that we're thinking about, and we did develop an assessment tool for that, but I don't know, do you have any input on that?
First of all, I think you should talk to Virgil because he's thought a lot about this.
Okay.
We can connect you guys, but
Yes.
I'll just write something.
Yeah. But I think the one thing might be just to think about how it is that the digital storytelling might work in the groups that you're talking about or for the purposes you're talking about. So, one of the questions I was asking Virgil at the beginning was like, do you want to be talking to people who watch the digital stories about the impact they have on them? Do you want to be talking to people who make the digital stories? Do you want to be talking to family units about the process that one person has in making the story and then how that impacts the family unit? So, think first about like what is it that you're trying to achieve with this tool, right? Because it's just a tool. So it's obviously a very powerful tool, but some of those questions I think would be the first things. And so if you have a traditional kind of assessment tool that's like a survey that you get online 3 days after the workshop about what the impact of something was, think about what that would measure and then what it might leave out, and then think about what you can add in as well.
Here's Virgil's email here, and if you Google NAHC TV, you'll be able to see some digital stories, and then it's nativehealth.org is our website. Yes?
I was hoping you could share the resource about the facilitator training for the digital storytelling.
Yeah, that's through the Center for Digital Storytelling is where you,
It's on the website.
yeah, no, you would have to look up Center for Digital Storytelling. I will tell you though that we have the in-house capacity to also train on workshops as well, and we can also provide workshops if that's something yes.
Well, we come from different experiences. I was born in Guatemala, and I don't know how much you know about the country I was born in. But in the middle of the 1960s, that we started to use these techniques. First of all, as a reaction against social scientists coming from abroad and exploiting the people, getting their data, publishing their PhDs, their books, etc., and never really giving anything back to the community. So
they would have no knowledge of anything like that.
we changed that, and we shift the whole way in which we were doing things at the university, in which the students have to work with the communities in an increased number of percentage of their time, beginning the first year 10%, and the last year working full time with communities. Every student doesn't matter which field. The problem is that in those days, the guerrilla started to develop in Guatemala too. Of course, at the eyes of the government and the repressive forces and their allies, I mean the United States, we became subversives. So the problem for us was, should we partner with especially the Indian communities, which of course in here there is a minority, but in my country, 60% of the people. And there is still called a minority, by the way, by academics, etc. What we did was completely different. We went and shared the techniques of doing research, planning, and programming, and then we got the hell out of there. It's your research. Don't share it with us. We are not into publishing books or papers or looking for grants, because that's not what it is. It is your tools, your skills, your values in your own culture. There are 22 different groups in Guatemala. And because we know that, of course, most of the research utilized in the social sciences is utilized for repression. We pay the price too. I left Guatemala in December of '79, came to the US as a history professor, and the next year, almost 100 of my colleagues were assassinated at the university, including 3 presidents of the university. So we are talking about different risks in different societies. But I thought that that was happening just over there. But when I went to teach in Minnesota, I became friends with some of the leaders of AIM, especially the brother Miranda. And they told me that out of their 56 leaders, 48 were either dead or in jail. So it is not just over there that happens this kind of thing. So for me, the risk, we have to explain to communities how risky this is to give your knowledge, your wisdom to people who may use it against you. And that's, for me, a value judgment. It's an ethical problem that we have to resolve and be very careful about it, not to help the oppression or the repression.
Do we have any other questions? I think I see somebody peeking their head in. Just a little bit over time, but I just want to say thank you.
Thank you so much.
Thank you.